To reduce the patient discomfort is very important thing, and I usually use the mucoadhesive periodontal dressing at palatal donor site. A new mucoadhesive periodontal dressing called Ora-Aid was developed. Ora-Aid is a dressing system comprising a mucoadhesive layer and backing layer and provided attached to a thin film. The protection layer here, the outer surface of the dressing, and to protect the wound area from the outside. And the attachment side here is the inner surface that attached to the gingiva. This part is attached to the wound. And this dressing can last for 1 day, but it can last for about a week if we can use suture together. Mucoadhesive dressing should be trimmed according to the length of the surgical site, and the excess of saliva and blood should be removed by gauze and adapt to the surgical site with 30 seconds of finger pressure. Ora-Aid can be applied to the both recipient and donor site in the free gingival or free connective tissue graft. The mucoadhesive dressing is stabilized the blood clot at palatal area and will dissolve in a day. But I used usually Copac for palatal donor site before, but patient had severe discomfort by the bulkiness in the palatal area. The use of Ora-Aid greatly reduced the patient's complaint of discomfort. Left side, just after the surgery, I did FGG and applied Surgicel and Ora-Aid and suture for the donor site. And this is just 10 days after surgery. Donor site shows excellent healing. The dressing will last longer if you use suture. I use cross-matrix ankle suture for dressing here. The needle starts here at the buccal side of tooth and passes through the palatal gingiva and go back to the buccal side of the tooth and make a knot. With this suture, you can stabilize the dressing very firm and easily, and there are less needle insertion points than conventional cross-matrix suture. This is a video of suturing the dressing. Okay. I harvested the de-epithelialized gingiva graft from the right palate, and I put some Surgicel for bleeding control and apply Ora-Aid before. And I did cross-matrix ankle suture. First, the needle go from the buccal side of the tooth, and then the needle goes through the palatal gingiva here and go back to the buccal side of tooth, and then make a knot here. Then the suture will compress the dressing very firmly. After FGG or connective tissue graft, I usually use the 3 or 4 suture of the donor site to stabilize the wound dressing. Let's see again. The needle go from the buccal side of the tooth and go through the palatal gingiva Sometimes the needle cannot go through the palatal gingiva easily if the palatal vault is too deep. Yes, and then the needle go back to the buccal side of gingiva. And make a knot. You can see clearly this area that the suture can compress the dressing very firmly. I will show you some soft tissue graft cases. I usually have couple of root coverage patients every week. Therefore, this procedure should be performed very easily for me and very quickly for me. And also, I should minimize the patient discomfort or pain after surgery. Here is a gingival recession on number 31 tooth here. This is very common case. Gingival recession extends to more than mucogingival junction and there is slight papilla loss too. Prepare the recipient site. I usually use Lango and Lango technique, but I don't try to make split thickness flap at lower anterior tooth because, as you know, the lower anterior area, the flap is too thin, and if you try to make it split thickness flap, the flap will be teared or perforated. Full thickness flap is okay too. It will show the same clinical result. And I harvested graft. This is just after the harvesting, and I did the de-epithelialization and fat tissue removal was done. Look at this graft. This one shows a great even thickness. The DGG is very good for handling, like suture of the graft. Place the graft on the recipient site and using mucoperiosteal releasing incision, the flap was advanced coronally and secured with sutures. The position of the graft and flap is kind of overcorrected. This is about 8 days after surgery. The wound shows good healing state, that there was a slight sloughing of the graft here, but you can check the revascularization of the graft here. And this is just after the surgery, the left side. I applied the Surgicel and Ora-Aid to cover the wound and the suture. The suture helped the dressing last for few days. And this is 7 days after the surgery. The dressing remains at the wound site too. After removing the dressing, the wound site showed good healing state. This is about 2 weeks after the surgery. Compare the pre-surgical state as CTG was successfully done. This is another case, very similar. I did root coverage using DGG as usual, and coronally advanced flap is done, and 8 days after the surgery, 3 weeks after the surgery. Here is donor site. I applied Surgicel and Ora-Aid, the mucoadhesive periodontal dressing, and sutured. 8 days after dressing, and the dressing was still remained. And this is 3 weeks later. You can check the almost complete healing of the palatal site. This is a soft tissue graft of implant. Number 11 implant was placed about 7 or 8 years ago, and at buccal side, there is a soft tissue concavity and sinus tract opening here. And the marginal bone loss is found in this periapical x-ray here. So I removed the crown and abutment, and after elevation of the flap and conventional root planing around the implant was done. And this picture shows the tetracycline application of the exposed implant here. And after that, I did some bone graft using bovine bone, and I applied collagen membrane and I did additional connective tissue graft using DGG at number 11 implant site to restore the buccal volume and eliminate the sinus tract and suture the wound. This is surgical splint to stabilize the palatal wound, also for hemostasis. On the surgical splint, I also applied Ora-Aid too. Most of the patients doesn't have discomfort using this splint. They can eat some food with this appliance too. Surgical splint is made using the vacuum former, and I use the 0.5 mm thickness sheet. It is very easy to make. This is a surgical splint, and just after you harvested the graft from the palate, apply this splint for bleeding control, and then you can go to the recipient site and put the graft and do the suture. 7 days after the surgery and after stitch out, the wound shows good healing state. and the mucoperiosteal dressing is still here. So we performed a clinical trial to figure out the effect of mucoadhesive periodontal dressing. We recruited about 35 subjects, and each subject underwent periodontal flap surgery at 2 quadrants. One quadrant assigned to group 1 and COPEC was applied. And the other quadrant was assigned to group 2 and we applied Ora-Aid. As a result, there was significant difference according to the postoperative pain. Ora-Aid group showed significantly lower score of visual analog scale of the pain after 1 day after the surgery. As we confirmed in this research, the advantages of mucoadhesive dressing are less pain and discomfort, and less required time, and no limitation of working time, and superior aesthetics. Okay, these are take-home messages. Before we perform the soft tissue graft around the natural tooth and implant, it is important to understand the histological differences between the two tissues. Free gingival graft can be done for function, and it is relatively easy procedure to high predictability, so it would be good choice to maintain periodontal hairs around the implant. For aesthetics, connective tissue graft in anterior region for root coverage is the most common case. For easy graft harvesting and handling, DGG it will be the good choice to reduce the patient's discomfort applying mucoperiodontal dressing, and surgical splint is very helpful. If a soft tissue graft is performed with a proper procedure for a proper indication and proper treatment is applied to the surgical site, especially the donor site, patient's discomfort can be reduced highly, predictable treatment results can be obtained. Do not be afraid of soft tissue graft, but actively try them. Okay, this is what I got, and thank you for your time and thank you for your listening.